Hello and welcome to Real Menopause Talk. My guest today is Dani Binnington. Post-cancer and surgical menopause are two huge and hugely important subjects. Dani has experienced both. She is a mum to 3 girls, a nutrition coach, a yoga teacher, and many more wonderful things. She is also a delight to talk to. This episode is a full one with golden information for absolutely everyone, whether you are a cancer survivor or undergoing treatment, or even if you know someone who is. So here she is. I will let Dani get straight to it.
How are you today?
Very well, thank you. How are you?
Yeah, very well. I just had a chat with an integrative medicine doctor and she was amazing. And I feel very inspired by her.
Well, Dani, it is a privilege to meet you. Thank you so much. Would you like to start by telling me a little bit about you, yourself, your family?
Hi, Hattie. Thank you so much for having me. And hello, everyone who's listening today. I'm Dani. Today, I love to share what's in my wellbeing toolbox. That felt very empty at times in my life, and I had no plan of what to put in it. And now I feel like it's flowing over and bursting out, and there's so much I need to share with everyone else. So much I did worked and so many things didn't work. And I'd like to share a little bit of both, really, from my journey.
Wonderful. Where do you come from? Where were you born?
Yeah, so I was born in Austria and I came to the UK when I was 19. And in my first week of arriving into London, I knew I needed to stay. I loved it so much. And now I've lived here for much longer than I've lived back at home. And if I could swing a flag, it's yours. Absolutely love it. Yes.
And what about your family?
Yeah, so I then studied here. My family's back in Austria, but I went to uni here and I met my husband here when I started work. And now have a big extensive family in the UK as well, which is just wonderful. Yeah, it's wonderful to be here.
Well, I can't wait to hear about all the things you have done and everything that you are doing, which is very exciting. One of the reasons that we are talking today is that at 33, you were diagnosed with cancer. Can you tell us what happened?
Yeah, and it's interesting you ask me about where I'm from, actually, because we decided to go back to Austria on a gap year when my 3 little daughters were before they started school. And we thought this is a great opportunity to live back in Austria for a year. My eldest wasn't even 4, so she wasn't in school, so it felt doable. We could take that gap year. And a few months into being at home and with my family, I discovered a lump. For me, it was a lump. Breast cancer isn't always, but I had a grope in my armpit watching the telly, and there it was. And initially, it felt like life was happening to us. Of course, the first couple of weeks, I thought there's no way I'd have breast cancer. I'm far too young. I've only just finished breastfeeding a year ago, my 20s. It didn't seem possible. And so I went to all the appointments myself, actually. And I even had the results appointment. I sat on my own in the doctor's office because there was no way I thought this could be cancer. And so it was actually a real shock, of course, having been told that I had cancer, but also to be there on my own without anyone's support. And then it felt as if life was happening to us. I did take little bits of control, but really we stepped on the escalator and there was no way off at the top. We had appointments happening, they were scheduled in, chemotherapy, radiotherapy, multiple surgeries, many complications. And it took a long time for me to then think, where am I within all of this? And do I have a say? And am I an empowered patient? Because for a long time I wasn't. And I remember this one day of sitting opposite the oncologist, and my dad and my husband came with me to the appointment. Actually, that was a second opinion. And I sat on the side. So it's like you and I sitting talking. That's the oncologist, my dad and my husband. I was a grown woman, Hattie. I was 33. And I was sitting on the side as if I'm not even part of the conversation. I was too worried about what he might say. So I didn't ask the question. I had so many worries I couldn't verbalize. I also didn't even know what to ask for. I just wanted it to go away But of course, it didn't go away. My worries amplified by me not talking about them.
I think that's so often the case when you go to a specialist for whatever reason, that you don't know what to ask to begin with, so you don't even know how to ask it. And there is such a fear, whether that be of what happens next, or you almost don't want to tempt fate by asking certain questions. So it sounds great that you had your husband and your father there to advocate for you, but yes, being slightly on the side. So what happened next?
Yeah, of course, it's so good to have people there with you. I just so remember that I was so shell-shocked and I couldn't find the words, and I just wanted someone to say, you're going to survive. But no one was ever going to say that, of course. No one can tell you that. And so it almost seemed to me I didn't want to know anything else. Nothing else was important. I just wanted someone to say, you're going to be all right. And no one ever did, and no one ever has done. And I think that for me was the hardest bit about survival. Survival to me always meant then uncertainty, not knowing what's coming next, and always living with my fear. And for a long time after my active treatment finished, I was consumed by that fear. Every single day of my waking days would be consumed with me worrying about my cancer coming back. And people kept saying, it's great, you've done it. Dani, well done. Your hair is growing back. And oh my gosh, it's amazing. You've done so well, especially with your 3 little girls. But to me, it never ended. It didn't end. Because to me, I was still really battling life. And so there was this big discrepancy between my world and what I was experiencing. So it was so real. And between other people's reality. And that was, wow, look at Dani. She's done it. She's got through treatment. She's come out the other end. And now she's got the rest of her life to look forward to. But my experience of that situation was not like that. And so I felt isolated, lonely, and just scared. And I don't know what happened, Hattie, is the answer to your question. I don't know what happened and what my turning point was, but I think it was fear and desperation and Googling stuff at 3 o'clock in the morning, like getting it all wrong, I'm saying, and thinking if I eat a certain way, I'm going to reduce my risks of a recurrence. If I do something else, I was just so desperately trying to find other things that I could do once the doctors had then done their job.
The need for control where something is out of control.
Oh, yeah.
Do you think that was it?
100%. Mm-hmm. Yes, absolutely. Initially, it was diet, because when you Google stuff about maybe cancer and risk of recurrence, diet comes up, right? It comes up with menopause. It comes up all the time, and rightly so. I had a few turning points there, but for me, it meant from one day to the next to eliminate major food groups. Big mistake. And it wasn't necessarily, and it gave me loads of stress, but I thought I'm going to cut out all caffeine, all meat, all animal products, anything that is ready-made, anything that is to do with gluten, anything that is to do with white rice, white flour, white other things like sugar, anything like that. Mm-hmm. Of course, anything like cakes and all of that. So if you had offered me a tonic water, I would have been upset because that contains sugar. And so because I wasn't a very good cook, Hattie, Tim did a lot of the cooking, my husband. I don't know what I ate, but my days were consumed with cooking.
Right.
I was still scared about recurrence, but suddenly I was cooking in my kitchen all the time. And I cooked for the kids. I cooked for my husband, who was really sporty and is really sporty. And once I served him courgette spaghettis with an avocado sauce, he then went off to get himself fish and chips. And I thought, something's got to change, Dani. You can't sustain this. There was no joy in how we ate. It was just green and lean. You know, we used clean eating then. What a rubbish terminology, right? Yeah. But it taught me how to cook. And then my family thought maybe I'm a bit extreme with all of this. So they sent me on a nutrition in practice diploma course at Leeds Cookery School. And that was great because it didn't talk sense into me, but it helped me look at nutrients and diet in the bigger picture. And that was great.
I'm going to go off on a tiny tangent just for a moment, because there will be cancer survivors listening who will be just feeling so refreshed to hear you talking openly and honestly about your feelings. The people who care for people who are diagnosed with cancer, one of the things that is a challenge is to know what to say. Do you have any suggestions when someone is cleared, they're in remission, they're doing really well? Do you have any suggestions as to how it would be really nice to be received by people?
And I think it's so independent and everyone is so different.
Mm-hmm.
And sometimes it can be really helpful to ask, how is this situation now for you? Rather than congratulate everyone for having gone through treatment and coming out the other side. So maybe a little bit less assuming and more asking. And if your friend or person isn't ready to share their truth with them, because often you can't, then they have the choice to say, actually, I'm all right. But you at least give them the choice to say, this is really difficult and I'm finding the time after treatment harder than perhaps treatment itself. And as long as you give people a choice to answer as honestly as they're able to, perhaps that's all we can do.
Yeah, I think that's so valuable in many circumstances, but particularly in this one. So going back to your food, was it all plain sailing from there? Or what happened next?
It's still not plain sailing,
Of
Hattie.
course it's not. Life is never plain sailing, even at the best of times.
A couple of things have happened. And 8 gave me control. I changed the way I ate. It was consuming. That gave me control. I learned how to cook with vegetables. I became more educated in terms of nutrition in general. So that's helpful. But it also gave me hope. And that hope was that I am doing something for my body, for my health, for how I'm feeling, and for my long-term health. And that sort of planted little seeds that I'm going to be around for a little bit longer. It's like when you garden, when people garden and you plant bulbs in the autumn, you're planning for a future. You're planning for those flowers to bloom in the spring or in the summer. And I felt a little bit like that. I was planting seeds for my future health with how I ate. I knew, we know we can reduce chronic disease by eating well. And many people know that a good diet is very helpful on different levels. It's just really hard knowing how to do it.
Yeah.
And so that fear driver, that was actually, now looking back, it was just my motivator to stay on track. And then the joy came in because I then started to cook really good food. And now it tastes amazing. And I'd have you around my kitchen table without worrying.
Yes, please.
That you'd be going off to the fish and chip shop. No, you won't.
I was going to ask, were you cooking different meals for your kids and your husband and yourself? Because that's a sort of epic task in itself. But if your husband was getting fish and chips, I'm glad that changed.
Yes, I did so for about 1.5 years. But I think then I managed to sort of make food that we all enjoyed in various, variations. But yeah.
Mm-hmm. The other part of the reason that we're here is to discuss menopause. As you said, things are never plain sailing, but yours wasn't either. I've had a number of guests, wonderful, wonderful women who have had surgical menopause. That presents different challenges for different people. And often when they go in for surgery, they're very underprepared. How was it for you?
I was so prepared. I probably was the opposite to most people that I personally also speak to. Because from the time that I was this disempowered patient on the side of the doctor's office to me then being put into menopause through surgery, in my case, it was to reduce my risks of more cancers. So I had a double mastectomy to reduce risks of more breast cancers. And I chose to have my ovaries removed because I have a genetic mutation that increases the risks of ovarian cancer.
And did you choose to find that out, or was that a sort of byproduct of previous?
So after I was initially diagnosed with breast cancer, the doctors said it would be a good idea to go through genetics testing because of the type of cancer I've had, because of a lot of ovarian cancer in our family on my dad's side, because I was very young. And so a few of the sort of pictures fitted the mold. And so I had genetics testing and it showed that I had this mutation. So I had a double mastectomy and at 39, I had my ovaries removed. But in all those years until then, I already dabbled my fingers in becoming a wellness expert, and I had run loads of workshops with people, amazing menopause specialists, amazing doctors. And I always felt I wanted to bring doctors and scientists and other experts in, and I wanted to share that with my community. So by the time I knew I wanted to remove my ovaries and it was the right time for me, oh my gosh, I was empowered. I knew how to work the NHS. I knew how to get referrals on the NHS for second opinions. I chose my team. I chose my surgeon. It was really, really well planned. And a lot of the work I do now is helping women do exactly that.
Fantastic.
Because it's very much about what do we have access to and who can help you to feel better. It's as important than going on a treatment or changing your diet or going and turning up to yoga. I think it's an integral part of our healing journey almost. And so I knew exactly how I was going to manage my menopause after. There was nothing left to sort out afterwards. I knew I had everything planned. And that was empowering. So, I really knew I had moved on from that very afraid young woman who couldn't even ask a question, to asking the difficult questions, to becoming a difficult patient. Because the difficult patient asks the question over and over again because you might still not understand it.
Mm-hmm.
And the difficult patient asks, but why are you saying yes or no to a treatment? And I feel the difficult patient, and that definitely became me, said, tell me the risks and benefits to going on a treatment, to the risks and benefits to not going on it. Because we've always got to consider both.
Do you know what? I think that's such an English trait. I can't speak for other cultures, but certainly an English trait of not wanting to be difficult or awkward or ask too many questions. Or maybe it's a female trait. So yes, hooray for being the difficult patient.
For worrying to take up doctors' time. So many women say, I didn't want to spend more of his or her time. But no, we've got to rethink all of that, because whether you pay 250 quid for a private appointment or you have an NHS appointment, you're there, and in that moment you matter.
Yeah. What was your plan?
So my plan was to really ramp up my toolbox of what I was going to do every single day to support my current health, but also my long-term health. I knew I needed to look after my bones. And so I was already a yoga teacher then, but I thought, great, there's lots of weight-bearing exercise in yoga. But looking at my whole weekly yoga routine, I also knew that I perhaps lacked a little bit. And so I've started to come up with a method of using weights in our regular yoga practice. Yoga was the best for my mental health, to shift my anxiety, to help me feel connected again to my body that felt so broken. And so I knew I'm not going to let yoga go. That is a non-negotiable. But I also knew that maybe once a week I need to improve and incorporate weight training, because we know weight training is great for our bone health, long-term bone health, and to also stop losing the muscle that all of us are going to lose as we age. That was to look into my diet again and to go back to the drawing board and think, okay, is there someone, a dietitian, a nutritionist, who can help me now think, is my body different post-menopause to what it was like before? And I think that was crucial for me in really making sure I have adequate amounts of protein and fats, good carbohydrates with all of my meals. And I know it doesn't take long, but it was just going back to the drawing board and thinking, can I write up a little meal plan? Because I know that unless I plan, I'm setting myself up to fail. It's that good old saying, isn't it? Fail to plan, you're planning to fail. And so I knew I needed to plan a little bit again. And I also needed to tap back into more doctors and more scientists and more specialists in really figuring out what my medical treatment options were. Non-hormonal medical treatments, hormonal medical treatments. Because I feel as much as we can do and empower ourselves every day, there are things out there that can often help, whether they are antidepressants for some women who can't have HRT, for example, or they might be hormone replacement therapy. Mm-hmm. Or there might be a medication that helps with your bladder if you're constantly feeling that you need a toilet. And so it's important to open that toolbox as well and think, I might need more help. And then these are my options available to me. But you know, Hattie, after you've had a history of cancer, we need specialist care for that, because you can't just have blanket advice. Someone needs to talk to you about your particular type of cancer, the treatments that are available to you. And these are specialist conversations that we have to have.
In terms of in inverted commas, normal menopause, the HRT, not HRT is a huge debate. Post-cancer, as I understand it, most women are not able to take HRT. It is not available to them. into a surgical menopause, the women I've spoken to so far, so I have limited knowledge on this, have needed HRT straight away because they've said it's like being hit by a truck. So what are the options that are available if you are a cancer survivor who has a surgical menopause?
Yeah, it's a great question, and let's talk about it. The one thing to differentiate the cancer survivors, we need to be more refined there and almost say there are many, many people who have been diagnosed with cancer who might have had a surgical menopause, like you've said, or they might have had radiation that puts them into menopause. It stops the ovaries working, or maybe chemotherapy stops your periods. No one knows if they're going to come back or not. And so we have different ways of arriving in menopause. And then many cancers, there's no worry about hormone replacement therapy. So people have had maybe bone cancer or blood cancers, for example. There is no contraindication for hormone replacement therapy. Where it becomes difficult and where many oncologists say HRT is not advised is when your cancer has been a hormone receptor positive cancer. And that's when we often talk about breast cancers and certain types of ovarian cancers, for example. And then, yes, like you say, our treatment options are more limited. But I want to really women to know that we have treatment options. And they're not as readily talked about in the media because, of course, we talk about HRT or not to HRT. But it's important to get that specialist care so that someone can talk you through about your specialist options. And you've spoken about it. We often talk about the role of antidepressants not being first-line treatment for a woman in perimenopause or menopause. And it's because hormone replacement therapy is the first-line treatment. And a few years ago, everyone poo-pooed all of the GPs for prescribing antidepressants. And I always thought, oh, poor GPs. But when you've had a history of cancer, an antidepressant can be a really good treatment. I speak to many menopause specialists who work extensively and some just with women with a cancer diagnosis, with breast cancer, for example. And they use lots and lots of different antidepressants, not to treat depression, but to treat some of the symptoms their menopause presents them with. And so the antidepressant is almost used not for what it's prescribed for. This amazing doctor I spoke to recently said, Dani, we know these patients aren't clinically depressed, but some antidepressants can be used really well for low mood, for anxiety, for hot flushes even, and even for some bladder symptoms. So that feeling of constantly needing the toilet or waking up at 3 o'clock in the morning. And it can help with night sweats. But again, these antidepressants aren't used in the full dose. They're used to much smaller dosages to treat those menopausal symptoms. What happens is many women I speak to say, oh, my doctor has prescribed antidepressants, but I think they just want to fob me off because I'm not depressed. And so with someone who's had a history of cancer, we just need a lot more conversation, a lot more explaining, and a lot more asking, what are your worries? Are you worried maybe about the side effects, about coming off them? Maybe you're worried about feeling worse before you feel better. Are you worried about the stigma that comes with taking an antidepressant? And when we talk about those things, it can become a very valid treatment option. And just like antidepressants, menopause specialists have other medical options that are non-hormonal that can really help. I know they're not the straightforward route to someone feeling much, much better. And often it's a multidisciplinary approach. So for women who might be on aromatase inhibitors or tamoxifen, they've got really bad joint pain and joint ache. And I don't know if there is a medication that really helps for that, but it will be moving and finding access to yoga or something like that that can really help and support, maybe with some supplementation, maybe with a light antidepressant. It might have to be a few different things that we need to do. It sounds like hard work, and it often is, but we must understand that there are things out there that can help. And the worst is not to try anything and really struggle. I'd rather women try and give it a go because there's always a possibility it might really work for you.
And if it doesn't, you try the next thing and you keep on going until you find the magic pieces of the jigsaw puzzle that all fit together and make you feel good again. And sometimes part of that puzzle is talking to somebody else who has shared experience and who understands you. So everything you're saying today is just incredibly valuable. And I think just knowing to talk to your doctor and ask as many questions as you possibly can and be open about your fears is a non-negotiable as well. What has worked for you the best? And I know we're all individual, but for you so far, so you have yoga, your nutrition, looking after your bone health through weights, as well as the yoga. What else is in your toolbox?
I really needed to create a community around me that, like you say, was like-minded, because at first I loved the menopause conversation, but I felt really left out. And many women email me and say, gosh, the whole world seems to be going on HRT. It's not an option for me. I wish they would stop. But I want to say, no, you're just looking in the wrong direction. This is just not your group of women. Let's look and find women who have similar problems and backgrounds to us, and let's connect to those. And that's why I'm so grateful you have the conversation with me today, Hattie, because I know we're a small subgroup, but the more we can talk about it, the more we can say, actually, this is really, really, really tough. And by having fewer treatment options, it can feel so exhausting. And I just want women to know they don't have to give up, and there's always something we can try. And there are many women, hundreds and thousands of women, who feel a similar way. But one thing that has happened is many women don't want to complain about the symptoms of the menopause because they feel ever so grateful that they've survived cancer. And their symptoms of the menopause often go on for years after their initial treatment. And so it really feels wrong to women to moan about their dry vaginas, their itching thighs, their tinnitus, their sleepless nights. They often say, Dani, it's not that bad. I only wake once or twice a night. It's okay, I can manage. Their anxiety, because they feel it's wrong to complain. They've been lucky to get there in the first place. But I think we need to change that mindset. And so for me, what really helped me is find my group, say as it is, say how difficult it is, and then allow everyone to share their truth. Because like you know, the menopause space is a very judgmental space. There are many different opinions and people think it's either one way or another way, but no, it's not. It's all of it thrown into a box. And at different times, we do different things and we're allowed to change our mind.
Yeah.
What I'm doing this year and what I'm doing next year doesn't mean I have to do forever. I can change my mind. Guess what? and for me, partly in my toolbox for the next few years is hormone replacement therapy, because I've had specialist advice. My menopause specialist spoke to my oncologist, they spoke to my surgical team, everyone got together and they decided that, weighing up my risks and benefits, I have then decided as a patient that I would like to go on a form of hormone replacement therapy to bridge myself until I'm a little bit older, to look after my long-term health, my bones, brain health, heart health, whatever it is. It's another point for me that I have added in. But then I went to counselling for a lot of times, Hattie, and that was really important for me to process what's happened, to look into the future. Cognitive behaviour therapy was amazing. It didn't get rid of my hot flushes, of course not, but it helped me deal with them, accept them differently. I can't explain it, but It was awful when I was teaching yoga, suddenly thinking, gosh, my neck and everything was red. But I know people don't look and they don't care because they're there for them, not for me. And that's where cognitive behaviour therapy was amazing. And so herbal medication, I don't think I left a stone unturned. I tried so many different things. I dabble my fingers in stuff. Yeah, I think it's a little bit of everything, Hattie, maybe.
Well, I think that's a great thing. And I literally say every single day, you can change your mind. I can change my mind and so can you. And there's no need to judge me for going, oh, well, this is great, because maybe it was and then maybe it isn't, or vice versa. So always, always, always reserve the right to change your mind. Tell us about Healthy Whole Me.
Well, Healthy Whole Me started with me wanting to become a more healthier, more wholesome version of myself after cancer. And I knew, well, when my diet was really good, my mental health was still really bad. And so the whole became in because I thought, well, to feel whole and healthy as a whole, it's not just how I eat, it's not just how I move, it's also my brain health and it's also my heart health and it's my emotions and all of that. And then I started to share how I ate with my community, and I had hundreds of women in my kitchen and we cooked together because they always said, but how do you cook? I said, I'm not going to show you how to cook for my husband because otherwise we've got a whole village down the fish and chip shop, but I can show you some things. And so we cooked together. It was wonderful. I started to run yoga classes. I started to host well-being and workshops and yoga retreats. And then I really became outraged about the lack of support for women in menopause after cancer. So I started my first few programs and groups and charity workshops. And I've really want to work further in this space. And it's what gets me out of bed in the morning, because there is lots we can all try. And I want everyone to know we've got options, and to just open the conversation and make it part of survivorship, because it's a really important part of how we survive is managing our menopause. And yeah, if someone is listening, maybe supporting a loved one through their menopause, then it's just great for all of us to have it on the radar.
What happens next for you now?
Well, all morning I was planning workshops for Future Dreams House, which is a lovely charity. We've got an amazing 6-week menopause program coming up for Trekstock, a charity that supports young people in their 20s and 30s. I run my own programs, and we're recruiting lovely new staff as well, and that is to guide women through their journeys. I guess with whatever I do, I'd like to get as many people into a room and be honest and open and find out what we could all do, like fork out a little action plan. That's what I love doing. So we're going to do loads of that.
That sounds wonderful. That's kind of my ideal way to spend a day, is just sit and talk and plan and plot all the good stuff.
Yes.
Dani, where can people find you?
So I have a website. It's called Healthy Whole Me. So my little quest to becoming more healthy became a website. And on there you can find all of our retreats and workshops and everything. I'm on Instagram, Healthy Whole Me. I think those are the best options. And I also run the Menopause and Cancer podcast, which is very specific, I know, but for the right person, we have amazing guest speakers that pop in weekly.
Thank you so much for your time. It has been an absolute joy talking to you, and just lovely to meet you.
Thank you so much for having me, Hattie. Great to chat.
If you have any questions, please don't hesitate to drop me a line, hattie@realmenopausetalk.com. Follow us on the podcast apps. Subscribe to our newsletter by going to the website, scrolling down and hitting subscribe. And please, as ever, do leave us a review. You'd be doing us a huge favour, particularly on Apple Podcasts, as it signposts for other people to find where we are, and also moves us up the list on Apple Podcasts so more people can find us. Thank you for listening. I look forward to seeing you in the next episode.